Let's bring him in. I told you we reconnected with him. Dr. Joe Congini with us. Okay, Joe, let's get into this orbital fracture. Donovan Mitchell, my friend.
Yeah, all this darn technology in all these years, we've done pretty well. Sorry about that little skip there. But it's a nasal fracture. The nasal bone is not that thick of a bone, and I'm almost surprised in sports as aggressive as it is these days that we don't see these more often in basketball and in soccer and in even baseball and other things. But we see nasal fractures down at Children's. I was speaking to our division director yesterday. I went down to the surgical suite to speak with Dr. Way. Julie Way is a really brilliant young ear, nose, and throat doctor, otolaryngologist they call it. And she was explaining to me there are a few differences now in how they treat these. So they're not uncommon. You have to get it fixed within the first 14 days. If you don't do something about it, if you're not going to do the surgical realignment in the first 14 days, it's going to heal usually crooked. It's going to heal in a malaligned fashion. It's not going to look right. And so you have about 14 days, and they try to actually do it sooner than that. I think Donovan Mitchell's was in the first 5 or 6 days. But they want to reduce the swelling, and then they do what's called a closed reduction. That's the name of the surgery. And they use tape and casts to kind of hold this area up and allow healing to occur. There's not any screws that they place or anything like that for this surgery. It is through tape and cast. And the name of the surgery, obviously, is a realignment surgery as they lift this area up and allow it to heal. It has about 7 full days of no contact nowadays to heal. And then they use a face shield upon return. They're still using a face shield. A lot of the ENTs, and Dr. Way is not as much in favor of packing them anymore. You might remember the days when, oh my gosh, a teammate would move the person's nose back, nasal bone back, and people would play the very next day with a face shield. But nowadays it's at least 7 days for the healing to occur after surgery. And so they are not even evaluating, from what I read, even evaluating Donovan Mitchell until next Monday, I think, about return to play. So it's a little bit longer than it was, but I think the outcomes are better. I think these people heal with better alignment when they do this appropriate treatment that our ENT was talking about. So there is a slight change, but it takes longer for these people and athletes to heal. And that was new information to me. But, Ray, I had one other thing I wanted to ask you, too.
Please.
The other thing that I was reading about and just kind of scratching my head was about what happened in January in Kansas City with the amputations. You know, I mean, it was so cold, 4 degrees below zero real field temperature, wind chill 27 below. And now the fallout of that, I think they've done 12 amputations, mainly fingers and toes, but a few people have to go back on and a few people still waiting for amputations. What do we think about this? I know we don't get that extreme of weather that frequently, but does this push us further along towards some sort of heating unit or playing more indoors or other issues like that? Or what do you think about the amputations following those really cold days that we had in January?
Well, Joe, from you in the medical arena, I'm sure you saw this coming. We talked about it that week leading into that game, I remember, on how maybe they could push that game a few days when the weather might break. But if you remember, there's so much revolving around the almighty dollar with that game. If you remember, it was a Peacock game, so there was a lot of money tied to that game. Peacock wanted to specifically have Kansas City. They wanted specifically to have a night game, and they got what they wanted. The bottom line is a lot of people are losing limbs to frostbite for being there and maybe not being smart and bundling up. Does that mean going forward that we might need to think about this further? I think we do. If you remember, Buffalo pushed their playoff game a couple of days down the road. And I think what you have to do in these cases, Kansas City earned the right to have a home game, and they play outdoors. And part of their charm and part of the thing that they like is dealing with the elements. But at some point, we've got to put money on the back burner and look at players and fans and people's health and maybe push that game a couple of days. A couple of days, to me, is worth a couple of arms and legs.
so well said. And there's no doubt that these things usually only last in the range of 24, 48 hours and could, fairly easily move those games. And you're exactly right. It probably was a money thing after all. But maybe this will get people's attention. I don't remember and don't recall a game that had that many people with amputations as a part of watching the game. And so I hope that for the better part of Valor that we make those kinds of wise decisions next year. And again, a very wise answer, Ray. Thank you for helping me with the understanding of that. And I just wanted to mention a little bit today about a slight change in the area of nasal fracture, and that's what we're looking at for Donovan Mitchell. Hopefully we'll see him back by next week.
Perfect, Joe. Great stuff. A lot of people were wondering about that because it kind of snuck up on everybody. They knew that Donovan had been struggling a little bit with a knee. They didn't know about the orbital fracture, so there was a lot of questions. So thanks for hitting that because a lot of people are wondering. They need their aircraft carrier back, my friend, for those playoffs. That's for sure.
For sure. No doubt about it.
All right. Thanks, Joe.
Let's talk again next week. There's some good topics in sports medicine, and talk to you next Wednesday.
You got it. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital with us at 93.5, 1590 WAKR.